Nannies.
Nannies. N-A-N-I-Z.
N-I-N-I-S.
N-I-N-I-S.
What does that mean? No, nannies. That doesn't mean
Like
anything.
Well, buenos is it tardis yet? Is it buenos dias? It's still morning. Buenos dias. Buenos dias, nannies. All right, we had to, as you folks at home can see, we had to make just do a little beautician work here to remove some of the hair. We've got a really interesting looking scalp lesion that we're going to remove for our patient. And at this point, I'm just putting some tape down. I cut a little of the hair out of the way, you can see, so that we'd be able to work around here. Thanks, Gumby.
And alcohol.
Yes.
You have Gumby on the camera.
You have Gumby on the camera. Super Gumby. There's no need to fear. Super Gumby is here. Yeah. How are you today, Miss Gumby?
I am awesome.
Were you happy with the results of the football games yesterday?
I didn't watch any.
You didn't?
Only caught a little bit when they won.
Which team?
I don't know. Whoever Cam Newton played for.
Okay, now, how long has this been here? ¿Cuántos años tiene usted?
60.
No, años. ¿De qué? La pelotita, con la bola.
Oh, no, tengo un año más o menos.
A year.
Been about a year, okay. And has it hurt?
¿Te duele?
Adore?
No.
Has it bled?
¿Has sangrado?
No.
Okay.
Thank you.
Alrighty. We're going to clean this up a bit with some betadine. And then we're going to inject this.
So there's two? Or
Just one. Just this one. I don't know if our little job here is going to work very well. Okay.
En un momento van a hacer la inyección.
Wonderful. So we're just going to start from right about here, Gonzo. So back up a little bit and give us a cold spray, please. Can you see everything okay? No se mueve. Okay, that's good.
Why are they calling me and I'm not doing a procedure?
It's
Who's
just
calling
rude,
you?
isn't it?
Is that Miss Donna?
So we're using some
David.
lidocaine with epinephrine, right?
Mm-hmm.
Good. Wonderful. ¿Hay dolor?
No.
Poquito?
No.
No?
You got a text.
Hmm?
You got a text, by the way.
I got a text. Alrighty. Alright, so what we're going to do is we're going to make an elliptical incision around this, and then we're just going to take it out. And then we're going to throw some stitches in here, and we're going to call it a day. I don't think this goes very deep, but we're going to find out here in a moment. Okay, ready for the scalpel? Thank you, thank you.
Or
Just the scalpel at the moment, but yes, I'm going to need everything here just momentarily. You might want to go ahead and set some instruments up here for me, please, ma'am. Thanks, little Gonzo. Okay, if you feel pain, you tell me. Dolor dice, okay?
Okay.
Dice?
can't see it. Yeah, she can't see. You're gonna have to.
Can't see, that's fine. That's fine. You can adjust as needed. Dolor?
No.
No, good. Good. We're just doing an elliptical incision here, guys. And you can see the scalp is highly vascularized. Has she been taking blood thinners of any kind?
Yeah.
What is she taking?
Well, she takes
Just the
Tylenol.
Well, Tylenol's not really a blood thinner, though, so we should be okay. She's not taking a whole lot of aspirin, is she?
No, ¿no estás tomando mucha aspirina, Emma?
No.
No.
Bleeding pretty good.
Yeah, that's okay. That's a sign of a healthy dog. I mean, scalp. It's the cold nose that's the sign of the healthy dog, right? Very good. I'm going to hold the pressure on this for just a second. We're bleeding a lot. Do you not see it?
So whenever you put your
Yeah. I really need a second set of hands here because she's bleeding a lot. Yeah. Ready?
Let her bleed? Okay.
No, that's mean. Gonzo, be nice. All right, here we go. Hi, Dolor?
No.
No pain. Good. Okay, go ahead and hold pressure right on it. And you can see we've got the whole lesion. Can you see okay?
Okay, there it is.
Yeah?
Got it.
Do you want to focus? Okay, we can take the whole thing out. So, Gumby, if you'll get me the formalin for the specimen, we're going to send this to pathology.
Yes.
Good gravy, you bleed a lot, my dear.
She is alive.
Well, I know, but I don't want all that
You're gonna have
bleeding.
to fill in a free wash.
Well, I sure hope not. There we go, we're opening that up. This is called undermining, and basically what we're doing is we're just separating the scalp a little bit from the underlying tissue so we can pull it over and we can stitch this down. And Gonzo, when we're done, we're going to want to make a little pressure dressing around her scalp, okay? Because this is going to want to fill up with blood if we're not careful. Out after we get the pathology results in, or before, then later on you can look down in the video description area and I'll put the pathology. Okay, hold cut. Gumby, can you get us some hydrogen peroxide? It'll help us kind of get the blood out of the hair here in a second.
Oh, I'm out. I have to go get them in a minute.
Where's it located?
I'll go get it. Let me just finish up with him and I'll go get it.
Because the only way I'll be able to see well enough to make sure there's no hair down in there. Even though we trimmed it, we still have some hair pieces kind of working its way into the wound, is to wash it first. Alright, so 4 stitches. This is, now just so everybody knows, the patient's daughter is in the room with us, right?
Yes.
Okay, so you know, go ahead and trim that. This is going to ooze a little bit for a day or so, but we're going to put a dressing on it, so hopefully we can prevent this from bleeding a lot. Good, well, actually we got together, that came together pretty well. What do you think? I think we did a pretty good job there. So Gonzo, you're going to get us some hydrogen peroxide? I'm happy with that. No, se mueve, por favor, mucho. Last thing I need is a stab wound from a scalpel. We have 2 video cameras going, so we have the over-the-shoulder view too, right? Did you record all of it?
Yeah.
Okay. And we'll take our tape off here. Down there. But there we go. I think that gives everybody a pretty good idea of how this has come together. I think we want to leave just a little bit loose, you know, for some drainage, okay? But overall, I'm pleased with that. That came out pretty well. And we'll end up putting a little wrap around here for a day or so to kind of provide a little compression. And we're good. So that was fun. Gumby, thanks for your help. Coconut. I'm sorry, not Coconut. Gonzo. Gonzo was a big help. She just stepped out to go get some more peroxide, or get some peroxide so we can wash this up. So we'll take care of our patient. You did very well, muy bien. No hay problemas at all. It went real well, okay? Nice. Everybody remember Nani's? We took the lesion out of her scalp, right, Gonzo?
Yes.
And we got the pathology report, and the pathology report showed a squamous cell carcinoma, or was it a basal cell? Let's see. I don't remember. I knew it was cancer. Let's see. It was a basal cell carcinoma. We referred her to a skin specialist, and you had more surgery, right? Okay. ¿Cuántos? How many?
¿Cuántas cirugías? ¿Cuántas
Just
más?
one? Just one. So they just did a wider excision, right? Okay. And so what's going on now?
Ahora que le están nomás le dijeron que tenía que hacer más,
Sí.
más exámenes cada año. ¿Por cuánto? No.
Cada 3 meses.
Cada 3 meses. ¿Por cuánto tiempo no le dijeron?
No.
No. She has to follow up every 3 months.
Okay.
They haven't told her the length of time she has to keep following
All
up
right.
to make sure it's
So we didn't need any other kind of treatment, just a wider excision. No, no chemotherapy, radiation, nothing like that. Just a plain skin basal cell carcinoma. Okay. All right, and you're here for another problem today. Dolor en su estómago, right? Pain in the stomach, and you've had a history of this. Hay historia de dolor en su estómago? ¿Sí?
Que ha tenido este problema anteriormente.
No.
Bueno,
solo-
bueno, sí, por eso le digo anteriormente, como la última vez que vino aquí
sí.
con el...
Sí.
Okay.
Segunda vez.
And you took medicine, and it was good. It helped it for a long time. But you ran out of the medicine?
No, ahorita no.
No, que ya no, se le acabó la medicina que antes.
sí.
Yeah.
See, okay. All right. Well, we've just examined you, and you still have a little gastritis, so we're going to restart the medicine for your stomach. Hay medicina para su estómago. ¿Comprende? Sí. Okay. Es muy importante tome la medicina para su estómago. Y el ácido es muy mal para su estómago y esophagus. Okay. And so we have to keep that level down.
Okay.
Pero se le va a dar la medicina y se la va a continuar regularmente. No todos los días lo va a tomar y él se la va a estar dando cada 6 meses.
Okay. So everybody would want to see. We're gonna move the camera. I want to show the picture on the scalp.
Okay.
So let's do that.
Okay, si quiere voltearse tantito para...
If we can find that spot. Donde? It's healed so well. It's hard to even find. Ah, there it is, right there. Okay. So Gonzo, can you get in there? Can you see? Go ahead and pick it up. Yeah, bring it over there. Can you see? So we've healed pretty well. We don't see any evidence of cancer or anything at this point. So it's muy bien. Thank you so much, Nanis.
Okay. Looked up.
Okay. So I've got you scheduled for a virtual visit, but you were telling me that you are out of vitamins. Do you mean you're out on Meta 7?
Yes.
You're out of Meta 7.
And I'm out of them, and I need them. I've been out of them for 2 weeks.
Yeah.
And when I tell you, I can honestly see and feel. I just feel the difference. I feel the difference in my body.
Mm-hmm.
It makes a big difference, and I need those vitamins in my life. I need them.
I'm going to help you out. That's not a problem. We can get you hooked up.
Okay.
Do you notice that it improves your concentration?
It improves my concentration. Not only my concentration, just my overall physical. Just because in the past, I think I even mentioned to you once before how I would feel so fatigued and just. I can honestly say I have not felt that on those vitamins, and I hadn't been having those headaches either.
Wow, that's really great. Well, I appreciate you sharing that with me. If you don't mind, I'm going to use that. Use your recording as on my YouTube video. Can I do that?
Oh, that would be great.
Wonderful.
That's great. Yes.
Thanks.
Because they are truly good. They really are.
You're
They're
awesome,
good
Dolly.
vitamins.
Awesome.
Yes,
Okay.
sir.
Are your nails and skin looking dry from the summer heat? Does your hair seem brittle and unhealthy? Well, maybe it's time to check out Cocoa Skin Plus. Cocoa Skin Plus is a custom blend designed specifically by Dr. Gilmore to restore your hair's shine, protect your skin from the elements, and make your nails strong and healthy. Let's hear from a few of Dr. G's fans.
I started taking Cocoa Skin Plus about 6 months ago, and since then I've noticed a huge difference in my skin. It's softer, my hair is softer, and it's grown so long.
I don't know if you want to zoom in. My nails have definitely gotten stronger, and finally my hair is actually looking normal. Thanks to this, actually.
Now available on Amazon with a dramatic price cut, Cocoa Skin Plus is only 50 cents a day. So stop waiting, order now, and experience the results you've always wanted. There's an Amazon link in the description.